What causes the kidney to malfunctioning? The kidneys are important organs that help filter waste and excess fluids from the body. There are many factors that can cause the kidneys to malfunction, including diabetes. Uncontrolled diabetes can damage the blood vessels in the kidneys, which can lead to kidney damage or failure. High blood pressure. High blood pressure can also damage the blood vessels in the kidneys, leading to kidney damage or failure. Infections. Infections of the kidneys, such as pyelonephritis, can cause kidney damage. Kidney stones. Kidney stones can block the urinary tract, leading to damage and infection in the kidneys. Medications. Certain medications, such as nonsteroidal anti-inflammatory drugs, NSAIDs, and some antibiotics, can cause kidney damage. Autoimmune diseases. Autoimmune diseases, such as lupus and IgA nephropathy, can cause inflammation in the kidneys and lead to kidney damage. Genetic factors. Some genetic disorders, such as polycystic kidney disease, can cause the kidneys to malfunction. It's important to note that some kidney diseases may not have a specific cause and can develop without a clear reason. Regular checkups and monitoring of kidney function can help detect any problems early on and prevent further damage. 10 warning signs that the kidney is toxic. 1. Changes in urination. This may include a decrease in urine output, difficulty urinating, or increased urination, especially at night. 2. Swelling. This may occur in the face, hands, feet, ankles, or legs, and may be a sign of excess fluid buildup due to kidney damage. 3. Fatigue and weakness. Toxins can cause the kidneys to work harder than usual, leading to fatigue and weakness. 4. Nausea and vomiting. Toxins can cause inflammation in the kidneys, leading to nausea and vomiting. 5. High blood pressure. The kidneys play an important role in regulating blood pressure. When they are damaged, blood pressure can increase. 6. Loss of appetite. Toxins can cause a loss of appetite, leading to unintentional weight loss. 7. Metallic taste in the mouth. This may be a sign of toxin buildup in the body, which can affect the taste buds. 8. Shortness of breath. Toxins can cause fluid buildup in the lungs, leading to shortness of breath. 9. Muscle cramps. Toxins can cause electrolyte imbalances, leading to muscle cramps and weakness. 10. Itching and rash. Toxins can cause skin irritation, leading to itching and rash. How to get rid of kidney problems. Manage underlying conditions. If you have an underlying condition such as diabetes or high blood pressure that is causing kidney damage, it's important to manage it effectively with medication, lifestyle changes, and regular checkups. Stay hydrated. Drinking enough water can help flush out toxins and prevent kidney stones. Aim to drink at least 8 glasses of water a day. Eat a healthy diet. A healthy diet can help maintain kidney function and prevent further damage. Avoid high-sodium foods and consume more fruits, vegetables, whole grains, and lean proteins. Exercise regularly. Regular physical activity can help improve kidney function and prevent complications from kidney disease. Quit smoking. Smoking can damage blood vessels and reduce blood flow to the kidneys, leading to kidney damage. Quitting smoking can help prevent further damage. Take medication as prescribed. If you have been prescribed medication to manage your kidney condition, it's important to take it as directed by your healthcare provider. In some cases, more aggressive treatments may be necessary, such as dialysis or kidney transplant. It's important to work closely with your healthcare provider to determine the best treatment plan for your individual situation. If you like the video, please subscribe and press the bell button for more interesting videos.